My name is Professor Stephen Brown. I'm a colorectal surgeon working at Sheffield Teaching Hospitals, and I'm here to talk about hemorrhoids in the evidence-based interventions programme for the NHS. Hemorrhoids are engorgement of what is a normal part of the anatomy of the anal canal. They're the vascular cushions. They become engorged and then they can potentially bleed. They can cause an itchy bottom. They can prolapse out and cause seepage around the back passage. So if you get these symptoms, you should see your GP. And your GP will want to exclude other potential causes of these sort of symptoms. And if your GP is convinced that they are hemorrhoidal in nature, then he or she may recommend further treatment. And the treatment is usually in the form of dietary and lifestyle changes. And most of the time, your symptoms will improve with these simple measures. You can obtain creams, ointments, and suppositories over the counter without the need for a prescription, and these may help with your symptoms as well. If your symptoms persist, your GP may refer you to a specialist. Now, the specialist will want to exclude any other potential causes of the symptoms. Once they're excluded, most of the patients with hemorrhoids, certainly the less severe hemorrhoids, can be treated as an outpatient with something called rubber band ligation. This is a very simple technique to carry out. It doesn't require an anaesthetic and usually results in rapid recovery with return to normal activities within 24 hours. Surgery is still necessary for some people, unfortunately. Those patients, for instance, that don't respond to rubber band ligation may need surgical intervention, and those patients with severe hemorrhoids. Unfortunately, surgery does have some potential risks. Those risks include, in particular, pain, which can last several weeks after the operation. You may get infection, you may get further seepage, and you may get further bleeding. This is why we tend to recommend that conservative management and rubber band ligation is carried out for the majority of patients. I'm a specialist in colorectal surgery, offering treatment for patients with hemorrhoids. For me, these evidence-based intervention guidelines are really important for ensuring that patients get the optimum treatment for their hemorrhoids, plus making sure that we use efficiently the scarce resources for NHS treatments.